Part of taking your baby home and getting ready for discharge is knowing what to do in an emergency. This video will help you learn infant CPR. Infant CPR is birth to a year of age, so we're going to hit the choking and infant CPR for that age group. Infant CPR is comprised of two main things, the breathing and the compressions. What we're going to do is we're going to look at both of those components separately, and then we'll put it all together as if it were a real situation. To get a good open airway for the baby to allow our breath to go in, we're going to put one hand up on the forehead, the other hand under the bony part of the chin, and we're going to rotate the head backwards. We don't want it hyperextended all the way back, nor do we want it down in the chest, but a nice open airway allows that tongue to go back and move out of the way so our breath will actually go in. So if I were breathing for this baby, my mouth would go around nose and mouth, forming a complete seal on that airway. Each of the two breaths, each cycle that I would give, are going to be enough air from my cheeks that would make that chest take a nice easy rise and fall. When we do compressions for the infant, we're going to put two fingers, it can be these two or these two, but where we're going to put it is middle of the chest, a little bit below where that nipple line would be. So for compressions, we are going to do at least 1.5 inches or about 1/3 the depth of the chest, and we are going to compress at a pretty fast pace, at least 100 times a minute. So it's going to have to go deep enough to actually compress the heart. We have to compress deep enough because we have to realize that the heart lies between the breastbone and the backbone. So to adequately compress that heart, we have to go down at least 1.5 inches to reach the heart. Now let's put it all together and see what it would look like. I'm supposing that I'm walking into the bedroom and I'm seeing the baby in this crib, and the baby doesn't look right. So the first thing I'm noticing is maybe baby's color looks off, something that tells me I need to investigate further. So my first thing is to stimulate the baby. So I'm going to rub the baby's back firmly. I'm going to flick the soles of the feet. I'm even maybe going to move the clothes up out of the way so I can look at that chest to see if there's any breathing whatsoever. If there's no breathing, it means I need to start CPR. But even if I see an occasional gasp, we can't count occasional gasps as regular breathing. We still need to start CPR. So the very first thing I want you to do is to move that baby from that soft mattress in the crib to a firm surface. We can go to this makeshift changing table. So I'm going to waste no time. I'm going to start in with cycles of those compressions and breathing. We're going to start with compressions, and we're going to do cycles of 30 compressions, 2 breaths. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 27, 28, 29, 30. Then 2 breaths. I'm going to simulate these. We're going to continue on with these cycles of 30 compressions, 2 breaths for a set of 5. That should take about 2 minutes of your time if you're doing it quick enough. At that point, if you have no one else in the room with you, is when you need to take the baby with you and call 911 to get help on your way. As soon as you get that phone call made, start back on the baby and continue on with those cycles of 30 and 2 until the baby becomes responsive or EMS arrives. In this scenario, we will be looking at the infant, which is birth to a year of age, during a choking episode. Choking is divided into conscious and unconscious babies. We're going to look at the conscious baby first. Let's pretend that we are sitting up at the dinner table and we are now, let's say 10 months old, and baby starts with a good strong cough. The very first step is to let them cough. We want to encourage good coughs. That is their best way to clear their own airway. The minute I decide to jump in with the conscious choking baby is when I can't hear sound, baby's trying to cry or trying to cough, and there's not sound. At that point, I do want to jump in before they pass out. So what I would advise you to do is slide to the edge of your chair, because this baby is very light, but in reality, nearing a year of age, we could be 20 plus pounds. So slide to the edge of the chair, and what you're going to do is grip the baby around their jawline, extend out one of your legs, and rest that baby head down with legs straddling your upper arm. With this free hand, you're going to give 5 back blows right between the shoulder blades, hard enough that you want to dislodge it, but not hard enough you're going to break their back. So 1, 2, 3, 4, 5. At the end of the 5th one, you're going to cup the back of the head and simply sandwich rotate the baby over to your other leg. In this position, same position as before, only your face up, you're going to use your same 2 fingers as we did in CPR and do 5 chest thrusts, exactly the same depth as CPR. 1, 2, 3, 4, 5. And that's all we're going to do for this conscious baby is 5 on one side and flip 5 on the other side. So in the process of flipping our baby back and forth, doing our 5 on one side, 5 on the other side, 1 of 2 things could happen. First of all, the object could come out and we'd be very happy and we could stand by and give them assistance as needed. But if that doesn't happen, the baby could go on to become unconscious. So if baby goes unconscious, what I'm going to have you do is going to look a whole lot like regular CPR. We're going to find that hard surface like we did with CPR. We're going to look in the mouth first to see if we can see it. If we see an object and we think we can get it, now's the time to go in there and try to get it. If we don't, we're going to rotate into essentially CPR with 1 added step. We know CPR to be 30 compressions, and we're going to do that with the hope of driving it out of the airway. So after my 30 compressions, I'm going to look in the mouth each cycle and see if I can see the object. If I can, I'm going to try to clear it. If not, I'm going to give my 2 breaths to try to breathe around that object. I'm going to continue doing these cycles of 30 compressions, 2 breaths, with looking in the mouth between each of those components. If I do 5 cycles and I don't have any airway back, I'm going to pick the baby up and call 911 and get help on the way. And then keep on going. Keep trying to get an airway on the baby till help arrives. We hope you found this information helpful. If you'd like to know more, you can contact the American Heart Association. Your baby's health during that first year of life is so important, and with these techniques you should be able to handle emergencies that may occur with choking or CPR within that first year of life. Thank you.